Well, it's now 6 p.m. If we're ready to go, Ms. Clerk, I will call this meeting of the Cunningham Town Board to order.
Ms. Wu,
Here.
Mr. Evans,
Here.
Ms. Hersey, Ms. Colasetti,
Here.
Ms. Bishop.
Here.
Ms. Wilkin,
Here.
Mr. Quisenberry,
Here.
Mayor Marlin,
Here.
Ms. Chenoweth,
Present.
Mr. Williams. Thank you.
Thank you. I would note it's Monday, February 14th, 2022. Next item on the agenda is approval of the minutes from January 10th, 2022. Is there a motion for approval?
I'll move to approve minutes from January 10th.
I'll second.
Moved by Chandra, seconded by Mary Alice. Any substantial corrections? Okay, will the clerk please call the roll? I'm sorry, will the clerk please
Okay, Ms. Wu,
call the roll?
Yes.
Mr. Evans,
Yes.
Ms. Colasetti,
Yes.
Ms. Bishop,
Yes.
Ms. Wilkin,
Yes.
Mr. Quisenberry.
Yes.
That motion passes. Are there any additions to the agenda? Okay. Next up is public participation. If you'd like to address the Cunningham Town Board, please raise your hand. Okay. I don't see anyone's hands raised. All right, we'll move on to committee to verify bills, the town fund and the general assistance fund.
Yes, and I just want to note Claudia Leitenhoff from Healthcare Consumers is in the audience, and I'll be asking her to join as a panelist on the first item of new business, just a heads up. So this past month, we had $58,304.61 in the town fund, expended from the town fund. And we had $112,705.67 expended from the general assistance fund. So the total in expenditures was $175,967.33. And I will give the rest during the officer's report. Any questions about the bills?
Mary Alice.
Yeah, I was looking at the bills and I noticed that there is Hart Technologies on here that we spent about $5,000 on. Would you be able to provide some more details on that?
Absolutely. So they're our security provider for the new properties. So we installed security cameras throughout those properties as was planned for.
Okay, so
And
those are, sorry, go ahead.
Oh, they're a new provider in town. I think most people are familiar with Pavement, but we did a bidding process and we selected Hart.
And is that that like an installation and or is it reoccurring?
No, it's not recurring. It's mostly one-time expenses. It is 2 servers, one for each building. The security cameras, which essentially are 360 around the outside perimeter of both buildings. And there was a number of wires that needed to be run. The internet connection, which would be the recurring expense, was actually donated by Volo.net. And so we will not have a recurring expense for internet going forward. And I mean, except for if something breaks and we have Hart come out and address the faulty issue, there's no recurring expenses or maintenance fees related to this.
Okay, thank you.
Any other questions on the town fund or general assistance? Okay, could we have a motion to approve both, please?
I'll move approval of the bills.
Is there a second?
I'll second.
Moved by Mary Alice, seconded by J.S. Any further discussion? Will the clerk please call the roll?
Mr. Quisenberry,
Yes.
Ms. Wilkin,
Yes.
Ms. Bishop,
Yes.
Ms. Colacetti,
Yes.
Mr. Evans,
Yes.
Ms. Wu.
Yes.
That motion passes. Reports of officers.
I'm going to go ahead and share my screen for this section. Let me see if I can do that. Yep, it looks like I can. Can you see an infographic before you?
Yes.
Okay, great. So this is, I also just sent it to the town board members in your email, and this is going to go out on in a blast to our listserv and on our website. Essentially, thanks to our intern, Jack Mazka, who is doing a capstone with urban planning in our office. He helped to produce this year's infographic. At the end of each calendar year, we've been trying to put together data for that calendar year. We also track things by fiscal year, but the calendar kind of wraps up the year for us. And so we were able to count 10,705 people served in Urbana in 2021. You can see for general assistance, we served 282 households, and you can see the total is about $340,000. Rental assistance was at $90,658, and we served 78 households. And then we, as you know, we run emergency housing that has served in 2021, 28 adults and 42 children. These are all children in Urbana School District or staying at Crisis Nursery. For subsidized housing, we worked hard in 2021. We had 59 households move into subsidized housing, whether that was through housing vouchers for the homeless or seniors or people with disabilities who moved into some of the openings at project-based voucher locations like Steer Place. We also launched a program to provide housewarming gifts to furnish apartments for homeless residents, and we did 25 housewarming gifts. With disability support, 21 of our participants received SSI support last year, which is fantastic, and 15 were awarded SSI payments. So 21 were helped in the application process and 15 were awarded SSI payments. And there are delays. The ones awarded are probably counted from the year before as well, because it's a multi-year process to get on disability. In terms of food support, which is something we launched during COVID, with our partners Channing Murray Foundation, Sola Gradia, and Solidarity Gardens, we delivered 699 food buckets to 1,264 adults and 850 children. These are all Urbana-based residents or people with children in Urbana schools. With Solidarity Gardens, we counted 3,835 pounds of produce that we produced just through the Solidarity Gardens initiative. That produce is then distributed through our Bucket Brigade collaboration, as well as used for the fresh food that we were providing meals for. We started just in the middle of the year providing annual bus passes again, since MTD started to charge, and we've provided 80 of them, whether that's through dash passes, where we help people apply for that entitlement, or through actual provision. So Grants does social services. We gave, and of course, we have a fiscal year process, so we counted last fiscal year in this case. 8 organizations received 118,000, and in their reporting, end of year reporting, it shows that they served 6,382 Urbana residents in that program. So that's an important and robust service to extend the services of Township. Utility support, we provide utility support when people are facing shutoffs or are shut off. We support it, and we do that throughout the county based on private donations we receive primarily through the faith-based community. We supported 89 households and did about $38,000 in utility assistance. And we launched a digital inclusion campaign, and we distributed 12 laptops, 18 internet connections, and 113 phones were distributed. And that laptop connection is in partnership with PCs to People and the Community Data Clinic on campus. So I just wanted to show, kind of preview before the public season, the good work that the Township did during 2021. Any questions about that before I jump to the supervisor's memo? Okay. Oops. Okay, great. So I will then just give a review of this last month, Valentine's Day edition. Nice artwork by Ricardo Levins Morales, who's based in Minneapolis. Just a plug for Ricardo. The general assistance, we are currently at 61 participants. If you look at our numbers of homeless residents, we are just going down, down, down every month. So we are down to 7 of our participants are homeless. That is because in most cases, we've been able to move our homeless participants into housing, much thanks to Pinewood. And we'll see the numbers in a moment with the Pinewood development that's made a huge dent in that, as well as the COVID vouchers. And you can see that we're serving 38 males, 22 females, and 1 transgender resident. We have 1 person, so we've launched our education employment track. I'm hoping that we could do a presentation of the track manager. We've reshuffled our staff, and so I have a new track manager over education and employment, and I'm maybe asking her to come and present to you. But right now, we currently have 1 participant who's enrolled in online classes, and then 3 who are approved searching for educational opportunities. So they go through pretty intensive kind of intake process to see what their current status is in terms of educational attainment, figure out what their goals are, and then we help them through the application process and pay any fees. That's the short version. You'll get a more robust picture of it in the future. With the disability and wellness track, you can see the number of participants awarded and how many we have supported. Essentially, transportation assistance, I spoke a little bit about that. We continue to do vaccination assistance. We've expanded it to all participants. So we just started with general assistance, but we decided to expand that essentially to our emergency housing participants, our rapid rehousing participants, outreach, and we are now paying $25 for each child. So, you know, there's a number of people in the household that can give $50 per adult and $25 per child for completed two shots of vaccination. And we've mailed letters and done follow-up calls thanks to our new social work intern, Abby. And so far we're at 41 participants out of 99. So we continue to track support on that. Rental assistance is going up. We're seeing an increase in rental assistance now that the emergency rental assistance at the county stopped taking applications on the 3rd. Actually, they extended it to the 6th past the big blizzard. And so we are also working with the Bridgewater Sullivan Community Life Center. They continue to do rental assistance and we do rental assistance. So we track people based on appropriateness. With housing advocacy, we continue to help people move into subsidized housing, and we're running at about 35% success rate, which is great. So we've gotten 61 households moved into housing. And you can see with Pinewood, we made 13 referrals and 7 of them are housed in Pinewood. So that is super. The Housing Authority, we continue to make referrals. We made referrals for the emergency housing vouchers. That essentially that list is closed until there are further openings, but we are helping people who we originally helped to refer and package their applications to locate and move into housing. And there's quite a bit of work involved in helping people locate housing and move in. And then of course we provide the housewarming gifts. Bridge to Home is the name we now have for our homeless continuum of services. I'm very proud to say that of the 36 residents who were actively unsheltered prior to the opening of See You at Home's low barrier shelter, during this winter storm, we did intensive outreach. We had gotten essentially everyone into the shelter. There were just a few folks who were choosing for various reasons not to go into the shelter, oftentimes to stay with their partner. And so we found 12 individuals who were unsheltered right before the storm. And we put 2 of them in the hotel through the week, and 9 moved into shelter, and 1 person chose not to shelter, although my understanding is that in the middle of the night he did seek shelter. Emergency housing, we had 7 individuals sheltered in hotel. So we do have ESG funding to shelter folks in a hotel. We do support people who are medically fragile. We are seeing an increase in discharges from Carle Hospital of folks who I have concerns about whether or not they should have been discharged. They have significant medical issues. So we are doing some housing, working with See You at Home on that. We did house several folks who did not want to go to the shelter because we were concerned about them freezing during the blizzard. And then we continue to, we have myself and my program director on the low barrier shelter steering committee. And essentially that program at See You at Home has reached capacity, but they opened their conference room to house overflow and we're asking for volunteers. So I'm not aware of turnaways based on being full at that shelter, which is great. We continue our rapid rehousing program where we provide 12 months of rent for literally homeless individuals and families. They have to be referred through centralized intake. And we have 6 households that are in that program right now. And we have several referrals coming in. Emergency housing for Urbana families, those are specifically in our properties. We've served 40 to date. And last month we served 6 households. We had 4 new families move in. It was quite a whirlwind. We have 15 children that are currently being served with housing. So with utility support, we continue to, Ameren is no longer doing shutoffs because of the temperature, but we do see water bills that are threatened for disconnection. So we had 2 households help last month, both for water. We continue to track eviction and are working closely with the court system and RPC. RPC is actually, it's not on this because it was just announced after I did the memo, but RPC has a new pot of funding to support people who are in a court-ordered eviction process to help with rental assistance. So that is great news because we were concerned with the end of the countywide rental assistance program, how we would kind of intervene in the court system. That's been an important tool. So that will continue. You can actually see all the first appearances. Essentially, you can see a high number in October of 49. And then, it inches up and down. So it's in the 20s right now in terms of weekly first appearances. Our digital inclusion campaign, we did have to interrupt a couple of events that we had for January due to the COVID spike. We didn't feel that it was safe to have indoor activities. So we are now looking to reschedule those in February. And Bucket Brigade is currently, we continue to, Channing Murray delivers 15 to about 15 Urbana households per week. We had a number, 229 neighbors helped last month, and there is a call for volunteer drivers. So anyone who would like to help out, the information is on this, and you could also call our office and we can direct you. But they are looking for volunteer drivers, multilingual, English speaking, to be great. I wanted to put in a few pictures of what it looked like because we actually ran out of coats last month and it was a dire situation. We asked for coats and I want to show you what the picture looks like. Here, let me make this bigger. It is just really amazing how our community comes together when we make the request. So we were deluged with coats. We are now asking, because we have enough winter gear, certainly we'll continue to take coats if you have them in the back of your car and have been planning on dropping them off, but you don't need to dig in your closets. We're now operating a diaper fundraiser. That's an important need for our Bucket Brigade. Anyone who would like to donate for diapers can either give to our Angel Donor Fund or actually donate the diapers at the front door or in the bucket in front of the front door at Township. And Solidarity Gardens this month was really focused on, we held a 3-week retreat. So we met for about 6 hours. And then we also met in committees, and we're really intentionally planning this year to increase production and engagement. We've launched an affiliates program. That affiliates program will have funding attached to it. So affiliates can actually apply for funding. This will be important for gardens like Learman Avenue in Urbana, which has at times struggled, with, I think they had their shed eaten out by a rodent at some point. They were missing some tools. They had various needs. And so that's one of those things where a little bit of money would go a long way to enable volunteers to grow food. So we're hoping to get submissions this spring for the affiliate garden program. And I'm happy to answer any questions that you have.
Mary Alice, and then Christopher.
Thank you for the report, Danielle. I was wondering for the Pinewood location, so I know that those are people who are waiting on SSI. Are there any other qualifications that you have to meet?
Yeah, so Pinewood it's essentially got, I believe there's 24 units and a portion of them, I believe is 5, is set aside for the statewide referral network. And 19 are set aside for folks who do not get disability payments, but are working with a township in Champaign County to get general assistance and get on disability. So there were referrals, I think all of the referrals came from either us or City of Champaign Township, but the other townships could have participated. So that part of your, Straight Referral Network. That is basically a network that's set up where referrals go through the state, and you have to be homeless or meet certain criteria, which can include having a disability, but having SSI. So if they go through the statewide referral network and if they're receiving SSI and they come to us with that need, we can refer them through the statewide referral network. And we just did another training last Friday on some of the updates to that system. But we work closely with the state in trying to make those placements throughout Champaign County, and that's one of the placement sites.
Thank you.
Chris.
Yeah, Danielle, thanks for the presentation. On the eviction hearing statistics, are those the number of evictions or just the number of cases that you've seen going through the system?
That's a great question. It is not the number of evictions. So the issue with evictions is that we can't get access to the information about actual evictions because of the eviction ceiling law at the state, which I think was an unintended consequence of that law, was that advocates can't quite access that information. So what we do have is how many had first hearings and then second or total cases heard that week. What I can tell you from talking to Kyle Patterson, who's our eviction prevention specialist, he's in eviction court every week, is that essentially about half of the people who come to eviction court are in the process of working on rental assistance. They have a rental assistance app. So what the judge has been doing is basically, if you already have a rental assistance app and you can make one at eviction court, we will help you fill out the application right there at eviction court. We go into a side room, we fill it out. So if you are actively pursuing rental assistance, the judge has shown generally will move that to a mediation process. So there is a court mediator that is funded through the county, and the landlord and the tenant sit down and mediate at that point. And a lot of that is getting the landlord to wait on the rental assistance payments. And then the landlord may have other concerns about the tenant. And so that's an opportunity for he or she to bring up those concerns. So it does require both parties to participate. And we'll get to that shortly in the source of income discrimination resolution before you, because that resolution covers two things. One, it says you can't discriminate based on source of income, which you can't in Urbana. But it also says that if you get COVID rental assistance, the landlord has to accept it. Like the landlord can't say, I'm just not going to take your money. I'm not going to take the state's money. I don't work with the state. I don't work on COVID. So that's an important piece. The landlord does have some discretion about whether or not they participate in the program. We have a couple of ways around that, and we do some landlord wiggling, and we haven't seen a whole lot of that, honestly, thankfully. But that is something that would be covered by the state law. So, yeah, so the answer to your question is 28 first appearances last week does not mean 28 evictions. I would hope that it would mean half or less of that, but I can't know for sure.
Thank you.
Grace.
Thank you. Thanks for the update and all this important work. It's all very important stuff. I think especially in the winter weather, it makes it even more in your face apparent of the urgency of this. So I'm so glad that we were able to have that extra low barrier shelter and, a few people out on the streets in this temperature it's a big deal. It's always a big deal, but this makes it even more in your face. So I appreciate that really important work and glad that those things were able to work out. I was wondering in the previous line about eviction court, if you could repeat or share a little more about, I think you mentioned RPC had a program coming that's, is that to help, you say with court fees, or could you that program more?
Yeah, so Regional Plan Commission was managing funds from the state through feds through the state that was for emergency rental assistance. Individuals also had the opportunity to apply directly for the state to the state, but their chances were much lower. So we were really lucky in this county to have locally administered rental assistance, because frankly, the rates of success are just much higher. And then we, the township, layered on top of that process, township packaging people's applications. So every application we sent to the county was complete, which is why our success rate was so high for Urbana. It's actually like double the success rate of Champaign. Not that I'm competing, but just to say it does matter when you have someone who can help you navigate services, which I think Claudia can speak to when we get to her piece. So essentially, let's see. What was your question? And I'm sorry, I'm looking at, you wanted to know about the new program. So the new program is a replacement for emergency rental assistance, which closed taking additional applications at the beginning of February, because they essentially think that most of their funding is guaranteed. They won't know. There may be another opening, but they didn't want to have people apply for funding that didn't look like it would come through. So essentially they got a different line item source of funding that will just be for folks who have they're in court in the eviction process. And this is really important because the RPC has played a huge role in supporting people at that moment, right? And they are also in eviction court and managing that process. So that program is for anybody who has got, they've got a notice to appear in court for eviction. And so we are sending anybody who is in that situation through that program. But most of the people come to that program through the court system. They get the notice to appear, but when they come to court, they find out about that program, or there are other ways. So that is really hopeful. Every single time we think, the funding has run out, something else, we scrap together another piece. It's not exactly what I would call the best approach to public safety. Imagine if we had to beg on the street for fire services every 6 months, but it is working because people are making it work. So we do have that piece in place going forward, and they will, use those dollars until they run out. RPC also has regular rental assistance dollars, just as they always have. So somebody who's not COVID impacted or not in the court system, who does not live in Champaign or Urbana, can also receive some rental assistance through that. So we continue to keep on moving with rental assistance.
Thank you. Yeah, that was another question I thought of too that I think you answered, is what are people applying for when, they might start an application in court? And you're saying there's other options besides that one emergency rental assistance that's ended. Is that right?
So there's RPC's rental assistance for people in court. Let's just speak about Urbana residents for a moment to make it easy. So if you're an Urbana resident, you're in court, you're going to go to RPC's program, or we're going to route you to that. You are an Urbana resident and you're behind on rent, Cunningham Township is going to process your application if you're not in court, right? Or you have a 5 or 10 day notice. And then we'll look at it and decide, does it make sense for it to be referred to Bridgewater or Sullivan Life Center? Or does it make sense for us to address it? And we have screening criteria for how we fork those, but we tend to send people to Bridgewater Sullivan Life Center because they have a lot more money and access to money. And so essentially but you have to be COVID impacted to receive that rental assistance. So if it's just that you get a disability check that doesn't make the rent, then that makes sense. Then Cunningham Township would be the provider. But if you're COVID impacted and the dollar amount is significant, then we refer. And they just got an additional allocation of dollars as well. So we'll continue to do those referrals. So right now, I feel like we're in good shape. You know, I would prefer a complete eviction moratorium, but I think barring, and we have requested that, and I know you all have requested it, but barring that, I think we're doing the best we can.
Thank you.
Any other questions? Okay, thank you. I don't think there's any unfinished business. Move on to new business.
Great. So I've asked Claudia Lenhoff, who's the Executive Director of Champaign County Healthcare Services, Champaign County Healthcare Consumers, to come and be with us tonight. And essentially, we've been Healthcare Consumers and Cunningham Township have been partners for many decades. And then during my tenure, we've increased that partnership such that anyone who is applying for general assistance is referred to Healthcare Consumers if there's any issue with Medicaid, SNAP, TANF access. And then after they get on general assistance, we also do referrals for anyone who's struggling to find a primary care provider, anyone who needs dental or eye care, anyone who needs prescription drug support, because there's oftentimes a copay, even with Medicaid, providing that support. So Healthcare Consumers is basically, as I think you all know, healthcare services is a very specialty area. It's hard enough to track housing, much less healthcare. And so what the lane that Township has really tried to occupy is the housing lane, because it's the greatest unmet need. And then we have pivoted, as you know, for this year of using the MOU process to really concretize our collaborations with our partners, to make it clear exactly what our expectations are, what they're going to provide, and what the compensation would be. So we are mid-year at this point, partly due to pandemic circumstances. If Claudia and I could have gotten in the same room earlier, we would have. But we did, with the first of the year, circle up because this is a service that we need and that we want to continue to rely on. And so we talked about how we could really deepen our partnership to provide much more coordinated referrals between our organization. So essentially what we're asking is that out of that $100,000 other grants line item that we set aside in the budget that the town board set aside, what we would do is provide $16,000 of navigation services in this calendar year. And then we wanted to add to the prescription drug and medical equipment pot, partly because sometimes that drains down and we're not able to support them. And then we use angel donor funds. But honestly, because Healthcare Consumers has a much better understanding of the prescription, like what prescription drug coverage exists, and there's a lot of different tricks to the trade. We'd much rather, when someone needs prescription care, to send them to Healthcare Consumers. So we've also suggested that we do reimbursements not to exceed $1,500 for the calendar year. So essentially anything that's paid for by an Urbana resident, they would then submit that to us. And I believe we're doing quarterly payments. So the MOU is attached. It lays out what the services are and what the conditions are. Some of it is boilerplate from all of our MOUs. And it also estimates 150 residents in Urbana will be served with navigation services, and about 25 residents per quarter would be, these are per quarter numbers, 150 per quarter, so 600 for the year, and about 100 residents for the year for prescription drug support. And I would like to invite Claudia, if you'd like to lend your voice to the conversation, and then also Claudia is here to answer any questions about the services of her organization. So Claudia, do you want to chime in and we can take questions?
I'd like to just make sure folks know that what's on the table or will be on the table is resolution number T 2022-02-002R, which is a resolution authorizing the supervisor to sign an agreement with Champaign County Healthcare consumers for healthcare assistance and navigation services. So we'll take questions with Claudia, and then I'll take a motion to get this for consideration. Any questions? Mary Alice.
Hi, Claudia. It's nice to see you here again. I have two questions. My first question is, I know in the past when we've done the consolidated social service funding, one of the items was that you were providing hours at Salt and Light. And now with COVID, which brings into my second question, I'm wondering if that continues or how your services have changed under the COVID.
Yeah, that's a good question. Our services are hybrid right now. Our office is not open for walk-ins or for clients. So we are serving a lot of clients remotely in whatever way works best for them, whether it's over the phone or email or Zoom or snail mail and things like that. But the other thing is we are actually more mobile now, going to more places where people need help. And like over the past year, we've spent a lot of time at motels in Urbana with clients. We had some funding from Urbana, thankfully, that helped to house medically fragile individuals who we were then working with to make sure that they got into the RPC system for housing vouchers. But then we could also work with them on, healthcare and prescriptions and things like that. And we've been to different fairs like at Shadowwood and different places like that. So yeah, not so much at Salt and Light, but other places. And we also just got funding from the Community Foundation of East Central Illinois for a grant that we applied for funding so that we could have more mobile equipment so that like, for example, this spring, if we go to a fair, like a health fair or just some kind of community fair in one of our local community areas, we can actually start working with people to start submitting applications right then and there, rather than just scheduling an appointment and then following up later. So yeah, so we're doing both, but I would have to say that during the pandemic, we've actually gotten out into the community a bit more than we had before, when our services were very much, more based, at our office or different locations like that.
All right. Thank you.
You're welcome.
Any other questions? Grace.
Thanks. I think this is another great thing to do and worth investing in. And I just had a question about the prescription drug coverage, because it comes out to just about $15 a person then on average. And I'm just wondering if that is, reasonable enough for the expected costs.
Yeah, thank you for that question. Yeah, sometimes we have people who just need help with copays. So it might be a low dollar cost, like $3 or $4 or $8, depending how many prescriptions they have. Medicaid has gotten better about covering the whole thing rather than requiring copays. But there are some plans where people have some copays. Now, every now and then we end up with a really big ticket item. And as some of y'all may know, there's certain kinds of prescriptions that are just really, really costly all the time, like inhalers. Inhalers are just ridiculously expensive, sometimes even with health insurance. And then and certain eye medications and things like that, or psychotropic medications, different things like that can be really expensive. So sometimes we have really big ticket items, and then other times we have a lot of small ticket items. One of the things that we do to sort of keep our fund going is that if we get a client referred to us, so let's say, for example, that we get a client referred to us from Cunningham Township, they are uninsured, or they just found out that they don't have insurance anymore, which happens to people all the time, especially with Medicaid. The state of Illinois has contracted with Deloitte for the eligibility system, and all of Deloitte's programs are really, really glitchy. And so people will get dropped from Medicaid and not even know it. They usually find out when they go to the pharmacy and need to get a prescription and they find that they no longer have coverage. So for example, if we get referred, if we have a person referred to us by Township who needs prescriptions, but they also need Medicaid, if their prescription is really pricey, we'll go ahead and pay it and get them set up with their prescription, even as we're working on their Medicaid, reinstatement or application. Now, Medicaid has a look back period of 90 days. So if somebody had incurred costs in the 90 days prior to getting doing their application for Medicaid, you can actually go back and have Medicaid pay for those costs. So we're fortunate to be able to work with the OSF outpatient pharmacy that's in the OSF hospital, but it serves the outpatient clients. And they are very much willing to let us go back to them and ask them to bill Medicaid for a certain prescription that we already paid for, and then they will reimburse us. And so that's a way of kind of stretching our money and making sure that it works. And so now, if we had been having this conversation 5 years ago, prior to the big expansion of, Medicaid, for example, I would have said, no, that is not enough. I mean, we're grateful for whatever we can get, but no, that would not be enough. Things are really different now, thankfully, but there are, some people do fall through the cracks and do need that help, but we have a way to, to make all of that work and to replenish the funds.
Thank you.
Any other questions? Chandra.
Hi, just a clarification question. I was reading through the resolution, and there are these funds and this program going to be for this calendar year, or is it for 2021? Because they're like both years in the resolution, so I just wanted to clarify.
It should just be 2022,
Okay.
which is the year we're in, but my brain is sometimes stuck in 2021. I don't know where 2021.
I know what you mean, but yeah, it's the
Is it like
second to last whereas and in the
Oh,
now
it's-
therefore.
Okay. Yeah, no, that should be, yep. Yeah, so actually you said the second, yeah, so that and in the therefore be it resolved should be 2022.
Okay.
Both of those. So if when you make the motion, you could move that the numbers are for 2022 calendar year, that would be great.
Can I add one more thing?
Sure.
Just real quick? Okay, just real quick. One of the things that I wanted to mention is that some of you already know this, and Danielle certainly knows this, but one of the things that happens when we work with people and we help them, for example, to apply for Medicaid, they need a lot of help throughout the rest of the year, because when somebody qualifies for Medicaid, they will then have to choose a managed care plan. They need to choose one that works for them, for their provider, but also to cover the prescriptions that they use. And so there's a lot of work that goes into that and making sure people are set up for that. And then also making sure that they know how to access primary care and all that. But then also, as I mentioned before, the Medicaid, well, frankly, all the states like Medicaid and SNAP, all of those systems are pretty glitchy. And so people will encounter problems. They will get dropped. They will lose their benefits. It's fairly easy for us to get that reinstated and get them reinstated with their benefits, but it happens a lot. And so every new client that we take on, we end up basically, it's hardly ever a one and done. It becomes part of the sort of staple of clients who we serve, and we will probably serve them multiple times a year just because of the way that things work or don't work.
Okay, I think we're ready to entertain a motion.
I'll move to approve resolution number T-2022-02-002R, a resolution authorizing the supervisor to sign an agreement with Champaign County Healthcare Consumers for healthcare assistance and navigation services.
Second.
Moved by Chandra, seconded by Chris, and we'll make sure that changes include changing the dates to the calendar year 2022 where relevant. Further discussion? Okay, will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Colacetti,
Yes.
Mr. Quisenberry,
Yes.
Ms. Bishop,
Yes.
That
Ms.
motion passed.
Wilkin,
Oh,
and
sorry.
Ms. Wilkin.
Yes.
Thank
That
you.
motion passes. Thank you, Claudia.
Thank you all so much. I really appreciate
Yeah,
it.
thank you so much, Claudia, for your time, and please share with your staff our appreciations.
Thank you. And not to be rude, I'm gonna jump off. I leave to travel tomorrow morning. So thank you so much.
Safe travels.
Thanks.
Take care.
Bye-bye.
Next up is Resolution T 2022-02-003R, which is a resolution authorizing the supervisor to sign an agreement with Watts Copy Systems Incorporated for color printer and copy services.
Yes, so actually, I guess you might want a motion on the table first, and then I can present.
Okay, is there a motion to approve?
Sure, I'll make that motion. I move approval of resolution number T 2022-02-003R, resolution authorizing the supervisor to sign an agreement with Watts Copy Systems Incorporated for color printer and copy services.
A second.
Moved by Mary Alice, seconded by James.
Just, it's very simple and straightforward. We had a copy system. It was under a 5-year contract. The contract has expired, and essentially we can either renew with the current copying location, but we instead decided to go out to bid, and we found a copy system that greatly reduces our costs and much better meets our needs. Honestly, we had a copy system that was way overbuilt for what we needed. So we are hoping to transfer to Watts Copy Systems. We've selected the copier and are just waiting on your approval to get it installed.
Mary Alice.
So I have 2 questions. My first question is, you had mentioned that there was considerable savings for this contract. Do you have an approximate percentage?
Yeah, I think that it's going to come in at about 1/3 of what we were paying, both for copies and for a monthly contract. It's
Okay.
pretty significant.
Then they have this, I realize it's only pennies, but they have these 3 tiers, right? Tier 1, tier 2, tier 3, and I couldn't find any explanation in terms of what those differences were.
Is
I
that
guess-
based on saturation or how much color is used?
So that's the 0 to 4%, 4.1 to 10%. That's the saturation.
That's what I was guessing when I read it.
I believe that's correct for the color. And this is much, much cheaper than what we were paying. The color in particular is where we save. It's also the case that we can control, and people will sometimes print in color and they don't know they're doing it, and it ends up being very expensive. So with the new system, we can actually control whether people print in color. So they have to force it to be in color. It can't default to that. Honestly, most of our will also just receive a lot of savings from that problem being solved with this new copier. So more than you would want to know about copiers, but it does make a difference. It really adds up.
I would just add that I've seen a lot of these contracts, and this is really favorable given the amount of volume it looks like you guys do. It's really, really a good deal.
It's also a woman-owned business that's local. And yeah, so we when we go out for bid, we have a certain criteria and screening. So it's not only far less expensive than the others, but local and female-owned.
Okay. Oh, Grace.
Thanks. Sorry, I'm not familiar with this kind of contract, so I'm just trying to understand. This would be that you have the physical printer, copier, scanner at Township, right? And then they also come and service and bring the ink and all that. Is that right?
Yeah, it's basically full service, which is what we have now. And there's service agreements where if it breaks, it can be fixed immediately. And if it breaks irreparably, we get a new copier without having to make payment. So
You provide the paper, right, Danielle? That's a separate.
yes, we purchase the
Cost.
paper and they provide the toner, I believe.
I think we're ready to vote. Will the clerk please call the roll?
Mr. Quisenberry,
Yes.
Miss Wilkin,
Yes.
Miss Bishop,
Yes.
Miss Colacetti,
Yes.
Miss Wu,
Yes.
Mr. Evans.
Yes.
That motion passes. Last item on the agenda is resolution number T 2022-02-004R, which is a resolution in support of HB 2775, barring source of income discrimination and protecting rental assistance recipients.
Yeah, and I also sent you an updated flyer in your email about this. I just got it this afternoon. They continue to add co-signers, so I wanted you all to have the latest in that. I'm gonna pull that up. See. Okay, so the resolution as written, basically, source of income discrimination is when a landlord says, I don't take Section 8, or I don't take vouchers. But they could also say, I don't take COVID rental assistance, or I don't take Township rental assistance. Cities of Chicago, Urbana, and several other in Illinois, but those are the two notable ones, essentially prohibit source of income discrimination already. Both cities obviously have robust rental markets. We don't necessarily prohibit discrimination against folks for receiving rental assistance, so that's an added value for folks in Urbana. It also so essentially what we see in Champaign County is that we let me just lay it out very clearly what it looks like. A homeless resident, we help them get all their documentation in order and apply for a COVID housing voucher. They go through a rigorous process, they intake, they get their voucher. They have 90 days to find housing. They begin to search for housing. And they are told when they go to Champaign, we don't take vouchers. And in Urbana, if they're told that, we call Carla Boyd, she helps us out. But typically in Urbana, we've done a lot of education and we've started to really turn the tide on that piece. So I think Urbana landlords understand that. But what happens is that they time out because they're looking for a place to live. They are discriminated against. I will say sometimes, in some instances, it is racial discrimination disguised as source of income discrimination, right? So when you allow that layer, you can come up with a reason to exclude someone, and we see that as well. But essentially, their voucher times out. If their voucher times out, they can ask for extension, but essentially, at some point, there's no more extension, and they lose their voucher. And this is a kind of a, I wouldn't say once in a lifetime, but it's a really unique situation right now that we have these vouchers circulating in the community. In addition, there are housing choice vouchers. And we have a record number of people in Champaign County right now circulating with vouchers. I have tracked the numbers when I was a Housing Authority board member. Every month I would track on a chart how many people were circulating. Now, of course, some of them had just gotten their vouchers, so it doesn't mean they always were facing discrimination. But the number jumped from 50, 60, it's now at 120 families that are circulating with vouchers who can't find a place or who are circulating and in some cases are having a hard time finding a place. It's the middle of the year. We see for rent signs throughout Champaign, Urbana, right? It's not the most opportune time, but they should be able to find housing at this point. So essentially what we're asking is for the Cunningham Township Board to lend its voice to the State of Illinois initiative to pass House Bill 2775. It's passed the House, it's before the Senate. Both Carol Emmons and Senator Scott Bennett are co-sponsors in the House and Senate. And it looks like we need about 5 more senators. And every single body that lends their voice to this helps Housing Action Illinois and HOPE Center for Fair Housing, which are the 2 groups that we work closely with, push this bill across the finish line. So I would ask you not only to consider passing this bill this evening, this resolution, which would then add our name as Cunningham Township, but also individually as elected officials for you to each add your own names. And I sent a link out a few hours ago for you to do that. So if you feel so moved, I would ask you to also consider signing on. I think it helps to hear from us, one of the few cities that does have source of income protections, that it's not a problem for us, right? So I think actually Urbana is uniquely positioned to really speak up and out on this issue. And if you have any connections in the Senate, I can send you a list of our targets in case you have friends in the Senate, because we have a couple of folks both in the Black Caucus and in rural areas who we are really trying to move on this issue. So, oh, there's one other thing I wanted to add. I was mentioning the housing choice vouchers and people circulating. My understanding from David Northern, he explained this to me, is that I said, why don't we have more housing vouchers in our community? We have the money. I'm looking at our audit report. Why aren't we not moving more housing choice vouchers? And he said, HUD limits how many vouchers, how much money for vouchers we can access if we have people circulating. So we actually have dollars that we could bring to our community for affordable housing to move people who are entitled to vouchers into housing, except we face barriers, and source of income discrimination is one of those barriers. We could actually house more people, and the dollars are sitting on the table in Washington if we were to house more folks. And the constraints throughout the county and Champaign are a part of that problem. And I've certainly spoken to the city council in Champaign. They're sick of hearing from me on this issue. And I'd like to see it happen at the state. If the city is not going to move, then I think the state should. So I would ask for your support on this. I'm happy to answer any questions you have.
We get a motion to get this on the table, please. Chris, did you want to make the motion?
I don't have the motion in front of me, Diane, so if somebody
Okay.
else could.
I'll move resolution number T 2022-02-004R, resolution in support of HB 2775, barring source of income discrimination and protecting rental assistance recipients.
I'll second.
Moved by Grace, seconded by James. Discussion. Chris and then James.
Yeah, Danielle, could you address the myth that housing vouchers require landlords to submit to a higher building standard, and that's why they are not taking housing vouchers?
That's a great question. So in the city of Urbana, we're lucky to have a rental registration program, and the units in Urbana are required to be inspected by our property inspectors. The threshold at the level of the housing authority is very similar. It is not dissimilar from the existing inspection process. And we work closely with that inspector. We know him personally, and he's fast and does a great job. And tries to move through the inspections as quickly as possible. So I think there's obviously disinformation about public housing. There's the specter of public housing. What people don't understand is that most people who access public housing are senior citizens or people with disabilities, and that public housing has been in place since 1937, and that it's been a safe, successful program with some bumps in the road in large cities. So I think that, in many ways, landlords aren't going to face anything different than what they face with the rental inspection program. And frankly, most landlords I know want their properties to be safe. There are a lot of liabilities that come from running unsafe properties. And so the basics that are needed to make sure children are safe and tenants are safe is just good. It's good business all around.
Thank you.
James.
I just wanted to say thanks, Danielle, for working on this and pushing this forward too long. Some of our neighboring communities have been able to keep people out of housing for whatever reasons they've chosen. They've pointed towards this as the reason for it, and it's not fair. It's not appropriate. It should be illegal, and I appreciate your work on this.
I think, are we ready to vote? Okay. Will the clerk please call the roll?
Mr. Quisenberry?
Yes.
Mr. okay. Ms. Colasetti?
Yes.
Ms. Bishop?
Yes.
Ms. Wu?
Yes.
Ms. Wilkin?
Yes.
Mr. Evans,
Yes.
That motion passes.
Great. I think the chair deserves applause for getting us to closure at 7 o'clock.
We all deserve applause. Thank you very much. And City of Urbana will be sending a letter in support as well.
Wonderful. Glad to hear it. Thank you so much.
Thank you.
Mhm. Good night.
All right, with no further business before the Cunningham Town Board, this meeting is adjourned and we'll begin the Urbana City Council meeting at 7 p.m. as soon as the clerk gives us the sign.
Ms. Wu,
Here.
We're going.
Mr. Evans, Ms. Colacetti,
Here.
Ms. Bishop,
Here.
Ms. Wilkin,
Here.
Mr. Quisenberry,
Here.
Mayor Marlin.
Here. And I will note that this is for Monday, February 14th, 2022. First item on the agenda is approval of minutes from the previous meeting of January 24th, 2022. Is there a motion for approval?
I'll move approval of the minutes from January 24th, 2022.
Second.
Moved by Jaya, seconded by Grace. Are there any substantial corrections? Okay, will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Colacetti,
Yes.
Ms. Bishop,
Yes.
Ms. Wilkin,
Yes.
Mr. Quisenberry.
Yes.
That motion passes. We have no additions to the agenda. I will note that we're working from the amended agenda that was posted online. If you're working from your paper packet, I want to note that item JB under new business, oops, sorry. At item J2 under new business has been removed. That issue is no longer alive. That was killed by the county. So that was removed from the council agenda entirely.
I had a question about the agenda. Also, I want to take something off the consent agenda, but I do that during the report of standing committee. Is that right?
Yes, you can ask to have an item removed from the consent agenda if you want to have it discussed further.
Thank you.
Okay. Okay, we'll move on to public input. If you'd like to address the Urbana City Council, please raise your hand. Brandy McCoy. You'll have 4 minutes to speak.
Hi, can you hear me?
Yes, we can.
Hi. So I'm here this evening to talk about a couple things. First on my list here is the fact that UPD has consistently refused to cooperate with the CPRB in a few ways, as we've heard in past meetings. But I wanted to make sure that the council is aware that UPD changed their policy, which required all taser displays and discharges to be reviewed by CPRB. The policy on their website currently shows that only discharges will be reviewed. Maybe I missed UPD coming back to council to make such a change, as for my understanding is required for use of force policy changes per city ordinance. I hope that's the case, but somehow I don't think that's it. The alternative is a police department unbeholden to oversight and accountability. So my question at this point is what's going to be done about it? Seraphin recently announced his upcoming retirement. So instead, I think he should be fired and should not be eligible for any sort of pension in relation to his position as police chief. This unlawful change in policy should not go unpunished. We are to achieve and maintain the level of oversight and accountability that the city of Urbana has promised its constituents. On another note, I have a question about the youth services funding that you guys are going to discuss later. The
Randy, we can't hear you.
Can you hear me?
Now we can hear you.
Okay, sorry about that. Champaign County Housing Authority's Youth Build Program could provide job training and alternative school intervention to young people. I'd like to hear more, like a more specific statement for why this particular program isn't being recommended for any funding, like what the grading system looked like. I know that there was mention of like a whole system. So, is it that it's not a very active program in Urbana? And if that's the case, would funding from Urbana promote more activity from the program in our city? I just don't see why we would forego the opportunity to fund any workforce training and certificate programs that aimed at our youths. I know that we have limited funding and that all of these programs are likely to benefit young people in our community in a number of ways. But according to the US Census, the most recent one, nearly 30% of our population in Urbana lives in poverty, and our per capita income is less than $25,000. So we need more people working for a living wage in Urbana. An expansion of workforce training is vital to meeting that need. If not this and not SWIFT, what is the city doing to expand workforce training specifically? So, and the last thing, I know I always come here complaining, and I know that that's probably tiresome. So one positive thing I want to note is that I want to applaud the 90% of the capital improvement plan being either on schedule or at least not critically behind schedule. So that's like effective, right? That's pretty cool. And I'm also looking forward to the discussion that's scheduled for today's meeting this evening. So thank you. Have a good night.
Thank you. Next up is Max Axelrod.
Hi, can you hear me?
Yes.
All right, Max Axelrod, resident of Urbana. I'm speaking to you tonight in my capacity as the campaign lead of No Ameren Shutoffs, a coalition of 53.5 member organizations and counting. There's one in the process of joining. Their vote already passed. They just have to designate a liaison. So last week, we disrupted Governor Pritzker's press conference in a grocery store in Springfield. And during that disruption, he again lied about policy. And the chants were actually pointing out that utility shutoffs for non-payment during the winter moratorium happened. Fun fact, he invested in one of those corporations that shut off people's power. So that sucks. We did not disrupt his press conference in Champaign. Instead, I walked right up to the head of security and gave him a copy of the Champaign County Board resolution saying that we were polite today and to ask him to deliver that to the governor. I did ask some other public officials who, for varying reasons, were not able to do so. That said, we also talked with some other people about the context for that struggle, including congressional candidates, 5 of whom have now signed our pledge to sponsor the Maintaining Access to Essential Services Act of 2021 should they win their election. 3 of whom are in Illinois, 2 of whom are in Washington, and to be honest, we haven't really reached out to that many folks just yet. And it is very probable that there will be more signatures in Central Illinois' congressional candidates for that very pledge. The context for this is that the Illinois student government, which has a decent portion of the population in Urbana, that is usually talked about when people want to deflect from poverty statistics. No, the students do not make up the overwhelming amount of poverty in this community. We already pointed out childhood poverty statistics contradicting that. But they were the first body to pass a resolution with the demand that Congress pass the Maintaining Access to Essential Services Act of 2021, followed by the McLean County Democratic Party and followed by the Champaign County Board.
City council meeting, listening to.
Phyllis, you are not muted. It's totally okay. Tech issues suck. So the main reason for pointing out all this context is that the city of Urbana was the first city council to pass any resolution on utility shutoffs that helped to spur the 12 resolutions that we've since passed calling on the governor to follow basic pandemic safety policy. And through the efforts of, admittedly, some of the previous folks on city council, but with support from current city council members, special thank you to Grace, we have managed to pass these resolutions and to get 5 congressional candidates, many of whom are expected to win their races, signed on to that petition or to pledge to sponsor the Maintaining Access to Essential Services Act of 2021. Correspondence with Rodney Davis's office, interestingly enough, he pointed out that it is in the Finance Committee, despite the fact that it has 2021 in its name. Happy Valentine's Day.
Thank you. Does anyone else wish to address the Urbana City Council? Please raise your hand. All right, I'm not seeing any hands raised. We'll move on to the next item of business, which is a presentation and an introduction to the fire station designers, and this would be FGM Architects and I believe Public Works. And is Chief Loss here tonight?
I don't know if the chief is with us tonight.
Yes, could Barima, could you admit Chief Loss to the meeting? Great.
There he is.
Okay, go ahead, please.
Just wanted to share a little background with everyone on the process so far through this. We issued a request for qualifications last September, received 10 submittals in October, and between October, November, and December, we reduced the list from the 10 applicants down to the 3 most qualified project teams for this, and conducted individual interviews with those project teams. I believe that was in late November, early December. And then coming out of that, the selection committee worked together to then reduce the list down to 1 selected candidate to work with, who was FGM Architects. Some of the things that tipped the scale in FGMA's favor were their project management approach, especially as the project transitions to construction administration. FGMA also demonstrated a greater ability to conduct cost estimating at a rapid, frequent, and cost-effective scale during the early planning phases, since the scope is somewhat loose still on these. FGMA also appeared to have more fire station experience that was comparable in size, cost, and geography to Urbana stations. And there was a general appreciation for FGMA's approach with the well building standard. The well building standard is a performance-based system for measuring, certifying, and monitoring features of the built environment that impact human health and well-being through air, water, nourishment, light, fitness, comfort, and mind. A little update on where we're at right now. We've received a contract proposal from FGMA the beginning of February. We are conducting internal professional and legal reviews on that, and we're hoping to complete those reviews here in the next couple of weeks and iron out final details with them by the end of the month. At this time, no services are expected to really begin until probably March once we get the final contract signed. But without further ado, I wanted to invite Jason Estes, who's a principal for FGMA Architects and who will be the project manager on Urbana Fire Stations improvements, to introduce himself and give you some additional background on their firm.
Tim, thank you so much. And apparently I need to bring you with me whenever I'm going to meetings, because you made me sound really good. So that's awesome. The FGMA, we have been in the business since 1945. We have offices as a national wide firm in Milwaukee, Wisconsin, Oak Brook and Chicago, Illinois, O'Fallon, Illinois, St. Louis, Missouri, Austin, Texas, and Reston, Virginia. We are a national expert within public safety specific with police and fire. We actually present on a national level to the fire community. And as Tim stated, we push the boundaries beyond just architecture. We make sure that we look at the building and the occupants to make sure that we're providing a well environment, since this is something that is a third of their life. We definitely look at the mental aspect of the jobs that we're looking at. We've partnered with actually a brain doctor as we've gone through on specifics on how we can de-stress the situation within the built environment. We are very excited about these projects. When we interviewed, we actually stated that with replacing 2 stations, it is a huge chance and opportunity within the department and within the city to really make a stance on how you want to be able to look at change. Not that you need change, but it makes such a big impact to be able to kind of set the ground rules on how to do things forward. And not everybody is able to look at this opportunity from this large of an aspect. So it's a very exciting project from our standpoint. We do participate in a lot of fire service projects and organizations, everything from state level organizations to local county organizations. We've actually done work at Springfield for the Firefighter Memorial. We've done work right on campus there with the training facility at IFC on UIUC. So we tend to, we really take this more than just architecture, and we believe that it is a calling, and we want to be able to make sure that we give back to public safety. As Tim said, we're really looking forward to kind of getting that first step, and it's going to be an exciting time. And from the first few meetings that we've had, I believe this is going to be a great process.
Chief Loss, did you want to add any comments, and then we'll entertain questions from the council?
Sure. Thank you so much, Council and Mayor, for the support in this. This has been a long time coming, over 50 years for these 2 stations. And I think everybody on council has seen the two old stations that we're going to be replacing, and the need that we have to move forward. This is truly monumental moving forward with these 2 new stations. One of the things that we really liked about FGMA was the fact that they were very progressive in the wellness program for our firefighters. I personally have 3 firefighters that have lost their battle with cancer due to things that were job related. So when FGMA came in, and one of their focal points was wellness of the station itself, that was very big for me as well. There's a lot of things that we're going to be able to do in these 2 new stations that will probably put Urbana on the map as far as changes that we want to see moving forward. These are 50 years plus stations. They're not going to be stations that we look at in 10, 15, 20 years of having to replace again. These are 50-year stations that we're looking at. So it's an investment. We know it's an investment. The commitment that you've made to help with that infrastructure is greatly appreciated beyond words. So thank you so much. We look forward to working with FGMA and making sure that these 2 stations, these 2 firehouses are going to be long lasting for the city of Urbana. Thank you again. I appreciate it.
Thanks, Jake. Any questions? Chris?
Yeah, thanks for the presentation. Jason, you're probably going to say yes, but just so for the folks at home, has your firm has experience designing decontamination and transition areas for firefighters to get cleaned up?
Yes, actually we have. We've actually done some proactive elements that are cutting edge. Some of them have been early enough that in time and as reporting has come in, it has changed even from there. We've done things as simple as full wash off areas and in gross decon. We've done offsite. Obviously, they're used to doing offsite decon, gross decon, but even internally, looking at things such as saunas or heavy showers, boot washes, things that can take contaminants not only off the surface but out of pores, out of things as quickly as possible so that it's not absorbed into the body, creating a wide open zone that no matter what the new technology, as the chief stated, this is a 50, 75-year building, whatever the new technology is, as the technologies improve and progress, something to make sure that we're not bringing those contaminants into the living quarters and keeping them isolated. The carcinogens are the major piece, and that's what the chief was talking about. So absolutely, we have experience, and we will press the questions and make sure that we challenge the status quo.
Thank you.
Grace.
Thank you. Thanks for the presentation. I was just wondering when or if there will be the chance for input from council and the public in these design plans.
Yeah, just to reference, the setup here is going to be kind of a phased approach. So once we get the initial phase set up, the idea is that FGMA is going to work with us to kind of flush out some of our conceptual ideas as to what all we want incorporated, costs associated with those things, to really define a more fine-tuned scope. And I think as we work through that process, we'll be coming back to council with kind of recommendations that come out of the conceptual design and feasibility analysis stuff.
Thank you.
James.
Yeah, I was wondering, Jason, if you could describe any projects that you've done that incorporated other community resources in the fire stations that you've worked on, like community rooms or resource offices.
So there's a lot of projects when we're talking about fire stations. So fire stations tend to be a community-based organization, mainly because you need them within a certain distance as you're looking at response, unlike a police station or something where you may have one for the entire community and they're centrally located. Fire stations are smaller and they're typically done within the neighboring communities. So it is a place where when you have a training room or something of sorts that allow them to be able to do training and meet, those rooms tend to pull a lot of double duty. So a lot of times they may serve as a community meeting room. They may serve as a homeowners association meeting, a Boy Scout meeting, a Girl Scout meeting, other type of meetings in there. But it's gone more than that too. We have seen a lot of times with in the public zone of the fire station, because we are looking at secure pieces, but inside that public zone, we've given offices to be able to utilize for different community groups. Within one community, we actually had an outreach program that was meant more for like a civilian corps of the police, to be able to allow kind of people to have a safe place to go to. We've done stuff such as community medicines, so intermodal medicine. So basically, they're able to, rather than going to a doctor or the ambulance constantly going to the same place, we've looked at certain places that can have staff that can go to the client with the vans and medical and be able to serve out of a fire station. I think the most extreme example that we did at one place was actually a conversion of a facility that was turned into a station, and in the back it was an old school, so it had a dance room. or like a gym, and they turned it into a giant community room that they hold father-daughter dances in on a regular basis in an older community, and it's been taken on greatly as a sense of pride within the community. So, to the imagination, I think there are a lot of opportunities. We would be interested in the communities that we go to see if there are needs or things that we can do to really build that community trust and strength. It is definitely an asset to the city.
Mary Alice.
I'm wondering if you might be able to email and you can coordinate with somebody on staff like Tim, just the locations, the towns, and maybe some example projects so we can get some ideas on items that might be feasible. You could send us like the towns and the type of project it was so we can look online and get some ideas.
Absolutely.
I can also share the original submittals from Jason that kind of highlight a lot of their experience with some of these things and highlight some of the different aspects of the different projects.
Chris.
Yeah, this question might be too early to answer this question, but Tim or Jason, my question is, how, I don't know, are there going to be any opportunities for local construction companies and local workers to get construction jobs out of these projects?
Absolutely. Once the designs are complete, it'll be publicly bid like all of our other public infrastructure projects, giving an opportunity for general contractors in the location and area to either work as a general contractor or work as subcontractors on this project.
Thank you.
Yep.
Any other questions? Okay. Well, thank you very much, Jason. Is there anything else you wanted to wrap up with?
The last question had to do with local contractors, and I know that one of our partners, our engineers, is actually within the Urbana Champaign area, Clark Dietz, who is actually doing a lot of road work with the city on different projects and all that, but they're actually be working on our civil and our mechanical, electrical, plumbing engineering. But with their local presence and their history, we'll make sure that when it's time as well, that we're going to definitely reach out to all the contractors to make sure that everybody is aware, because we want to be able to give everybody that opportunity. So that is on our forefront. But other than that, I do appreciate it. And I do say, again, this is an exciting time. I think the chief stated it. This will be a fun project, and we will be coming back to you hopefully with something that, getting your input and making sure that this is something that stands the test of time for the city.
Thank you. It's a wonderful opportunity for us. Thank you, Tim. Thank you,
Thanks,
Chief.
Jason.
Thanks, Jason. All right, we'll move on to the 2021 progress report. And this is our Public Works Director, Tim Cowan again.
I'm muted. That's fun. Okay, let me try that again. All right, can everybody see my screen now? It should just be kind of the progress report list up.
Yes.
Okay, perfect. Okay, so I put this together and I was trying to be as brief yet as detailed as I thought I could be to keep it concise, but really give you guys a good snapshot of where we're at on our 2021 capital improvement plan. Highlights, the green is kind of the effort has begun, or we're on schedule or ahead of schedule, or it's already completed. The yellows is we've either not begun or it's not quite to the phase that it needs to be at, but we're not critically behind at this point. And then red is it's either been deferred, eliminated, or behind schedule due to other needs. And we do have one new project that's on here that was approved in a previous budget amendment, which is part of the deferrals. So I'll just kind of walk through these and then I'll take questions afterwards if anybody wants additional details on this stuff. Certainly hope, in the future to get a little bit more interactive with this to kind of help everybody's understanding and viewpoint geographically for everybody. So the pavement management system, we engaged AppTech in 2019 to scan all of our roadways, and this is more of like an ongoing services thing. We are yet to get a contract formalized with them. We're hoping to get that formalized here in the next couple of months and have them assist us in updating our pavement management condition indexes based on other capital improvements that have been done, and then also help us forecast scenarios for maintenance rehabilitation projects based on some of the condition indexes that they picked up previously. The miscellaneous traffic studies is more or less a placeholder for us. We don't have any immediate needs that have been identified that require a formal traffic analysis. This typically is going to be used for maybe like a preliminary intersection design study or intersection design studies where we have issues or we've had accidents or something like that warrants a necessary study that's above and beyond what we'll do with our own staff. The traffic signal planning and the street light planning and the stormwater management planning, these are all have been discussed at the various council strategic goal setting meetings. These are all online and in process. We are waiting to formalize contracts with various consultants to begin development of these asset management plans. The intent behind these is kind of evaluating everything we have, the conditions, the long-term planning and budgeting for preventative maintenance, repair, replacement, life cycle cost replacements, as well as functional modernization and upgrades with these things such as signal modernization or streetlight LED conversions. We expect to have a contract executed with consultants to begin those in the next month, and likely to be completed probably by the end of the calendar year is our target right now for those. The stormwater management plan, this is one that was started before I got here. So it's about 1.5 years or 2 years in the making. We received a draft late last year, and we're just now really getting to reviewing the details of that. The intent is to have some internal meetings here this month and then follow up with the consultant on that in March probably, with an ultimate goal of coming back to council with some more formal information with that consultant on the stormwater management plan that they had worked on and get some additional feedback from council. The next two I'll talk about together: the storm sewer cleaning and televising, sanitary sewer cleaning and televising. Historically, we've contracted out the storm sewer cleaning and televising, but it's kind of fallen by the wayside the last couple of years with some of the turnover here in public works. The sanitary sewer cleaning and televising is something that we have typically staffed internally and done with our operations crews. In the CIP, we originally budgeted for funds to potentially do a little bit of both internal operations and external contract work on this stuff. And in our planning process, we decided that we thought that we could actually handle the entirety of the sanitary sewer cleaning with our in-house staff. So we eliminated that from being an outsourced contract cost at this time. And we're starting to work on bid documents to engage somebody to do the storm sewer cleaning and televising. And both of these, just high level view, the intent would be that we were targeting cleaning and inspecting all of our sewers on at least a 10-year cycle to identify major issues, spot repairs, rehabilitation opportunities before something fails catastrophically to the point that we have emergency repairs that are not just spot repairs, but longitudinal repairs of entire sewer runs. Those are, and sorry, I didn't touch on this, but those are more like management planning efforts. Those last two are kind of going to help us really help our outlay of our storm and sanitary asset reconstruction, rehabilitation in the 5-year CIP that it's somewhat been lacking in the last couple of years. Moving on, these are what I would consider more maintenance programs. So these are things that are probably happening pretty iteratively on an annual basis. Sidewalk maintenance, we are working on developing kind of a prioritization matrix similar to what we did with the roadway prioritization stuff. It's not a lack of need out there, I'm sure of that. So it's more kind of developing an internal process for how we get the information and the issues with sidewalks and then prioritize them so that we're addressing them efficiently. You know, some locations may need an interim fix where we go grind a vertical fault or we add a temporary bituminous asphalt patch while we plan to address it in a more permanent solution in the coming years. I think the intent here is that we are planning to develop a bid package to address the top priorities for construction heading into the next fiscal year. There have been some discussions about, depending on what comes out of the EQL, of partnering this with the EQL projects if there's enough need to put a bigger program together as we move forward with that. Bike lanes and side pass. This is generally for maintenance and repair of the bike lanes and side pass. We don't have any movement on this right now. Right now, we're considering doing any improvements and upgrades, spot repairs, things like that to the adjacent bike lanes and side pass with our capital projects that are listed further down this list. And just recently, and this will be coming to you in a budget minute next week, but I think we're going to defer the $20,000 that was allocated for this to support a raise grant application that we're pursuing for the Florida Avenue project, which I'll touch on a little bit more later on as well. Traffic signal maintenance, we've got these funds are kind of here for contracted services as needed when our operations crew can't keep up. And just for reference, we have 48 signalized intersections that require operations and maintenance, and those are more or less, when we have issues, those are immediate responses. And as of recently, we've had some turnover and some unplanned turnover in our electrical division. So this more now than ever has been very handy for us to continually provide the expectations of the traffic signals being maintained regularly. The next one is the facilities general rehab line. So far this year, we're under contract to replace the obsolete HVAC controls at the city building, and we don't have any other identified needs specifically at this time, but the plan is to utilize the additional remaining funds in that line for contingency funds for some of the other citywide, the city projects, including the citywide storage facility that's ongoing here at the Public Works site. Annual street maintenance. So far this year, what we've done is we did some road patching for operational concerns along the Windsor road stretch. We don't have other prioritized needs yet, but if and when we have identified enough that it's worthwhile to get somebody engaged on, we will try to do so. Typically for pavement patching that is critical, we are taking care of that in-house with our operations staff. This is more for larger scale projects that may include pavement patching multiple sections of roadway and blocks of roadway, and not just spot patching. The oil and chip seal preservation program has been completed. Generally, this took place in the northwest section of the city. And one approach we've taken since I've been here is trying to look at this as more of a preventative maintenance thing and try to cycle the city. So we're on essentially a 5-year cycle for our seal coating. Generally, it's recommended a 3 to 7 year cycle, depending on the use of the road and really the pre-existing condition of the road. Sometimes it will be sooner or later, but ideally what we're going to try to do with this is address some of those inconsistencies ahead of the seal coat so that the seal coat will last 5 years, and try to keep that on an iterative cycle for now. Joint and crack sealing is something I wanted to pursue when I got here, and we just have not had the bandwidth to really get this done yet. This would be a new program for the city. In the past, our operations crew have done some spot joint and crack sealing, generally targeting projects that we've reconstructed in the last 5 years. I think this is going to be a go for next year. Some of the funds of this, well, actually all the funds for this year have been deferred to the Washington Street Bridge reconstruction since being load rated. Pavement marking project. This is general preventative maintenance of our pavement striping. We have, depending on the areas, we have different needs for restriping. Some's 1 year, some's longer that this hits. And we spend about $30,000 a year getting contract restriping out there for things that our operations staff does not do. That has been completed. Storm sewer improvements and sanitary sewer improvements. This is mostly just repair work that's beyond what we're doing in operations. It requires confined space entry a lot of times. Usually spot repairs on sanitary sewers, storm sewers, and the depths can be as much as 25 feet in some instances. And I know we had one storm sewer repair that more or less resulted in reconstruction of the majority of an intersection. And it was a very large undertaking. Thankful we have a miscellaneous construction services repairs contract with Deuce Construction currently that have been helping us out for the time being on that. And generally speaking, we appropriate about $250,000 a year towards, or $450,000 a year, 250 from storm and 200 from sanitary, of which I think right now we've spent about 325,000 so far. So, and most of that has been storm sewer work this year. Bridge maintenance, the biannual contractual inspections for our bridges. We completed our last inspection in right after I got here in FY21. So we won't do that till FY23. We're working on developing an asset management plan for our bridges internally with our city engineer, John Zeman. And then I do think that we are going to end up spending this money or putting a little construction bid out to do some bank stabilization at the Perkins Road Bridge that some of the bank is starting to erode upstream of this structure. Boneyard Creek maintenance. This generally is for any miscellaneous needs along the Boneyard Creek. We haven't had anything major this year. Most of it has just been related to silt cleanup from floodwaters in the Boneyard area. And moving on now, this is the capital projects. These are kind of the really big standalone projects. The equity and quality of life project that we implemented this year. Applications are being accepted. I met with Carol last week, and I think we've got about 30 to 40 applications that she's kind of done a initial run through, and she's going to work with BPAC on scoring what we have right now to work on implementing this. So the plan is probably by the end of this fiscal year to get through what we've got and review those applications and try to build projects out of what's been submitted. The next few are all going to be kind of our facilities projects. So the citywide storage facility here at Public Works is under construction. They did site grading and clearing in December, and they're going to be prepared to jump back into construction come spring. I think they have all of their permits and everything are good to go at this point. I think the intent is for substantial completion to be done September 2022 on that facility. The city building interim reconfiguration. Some of the points for the initial purpose of the lobby reconfiguration were to improve the delineation of public and private space, improve the delineation of the police and then other business activities there at the city building, improve general security and wayfinding, and generally just improve the customer interactions there. Vince and Troy are kind of spearheading this one, and they met with the individual departments there at the city building to kind of talk about everybody's needs and wants to develop a scope. And at this time, I think we've got 50% drawings complete, and the intent is to get those to final completion and go out to bid this spring still with the construction contract for that to follow and probably be executed prior to the end of this fiscal year to get renovations underway starting probably in the beginning of next fiscal year. Fire stations 2 and 3, we kind of talked a little bit with Jason about this, but essentially we're looking to begin the design efforts probably in the next month. Conceptually, I think the idea would be is by the end of this fiscal year to get Jason's crew and the city staff engaged on developing alternatives for consideration for council to talk about final scoping of, everything that we want and then everything that, we intend to support financially as well. Public Works miscellaneous facilities, we had the interim arbor relocation, fleet services remodeling, Arbor and LRC rehabilitation and the public works rehab. The intent, I think, is to get architect engineer under contract by the end of the fiscal year to begin the design and planning process for those improvements. We do not have anybody engaged at this time. ADA life safety and then the citywide security improvements. The intent is to incorporate ADA life safety improvements at the city building reconfiguration project. And then the citywide security improvements are going to be dependent on what we select to implement at the city building. The intent will be that the security improvements will likely be implemented at all of our facilities. So that's to be determined out of the reconfiguration process. So again, these are not behind, but they just haven't begun yet, and they're not critically behind schedule. The ADA life safety is pending the city building reconfiguration and the security improvements as well. The Fairlawn project got deferred to reconsideration in this year's CIP. Generally, this was going to then support the Washington Street Bridge reconstruction project after it was load rated this year. So it's been deferred and it'll be reprioritized with the capital improvements in this year. Lincoln and Springfield project is underway. Construction started last fall. I think they've got most of the concrete flat work done along the west side of the road there. They'll pick back up here as weather breaks, finish the concrete flat work on the east side of the road, and then perform resurfacing once they get all that stuff done and utility adjustments. We are coordinating with Illinois American on this. They have some aged water main along Springfield that they would really like to replace. So we're coordinating with them so that they can get that replacement done ahead of our resurfacing, so we don't have a bunch of patches after it's done. So that's been a convenient find for us. The Ray Street resurfacing from Washington, California, we are all but ready to bid. We plan on putting that out to bid here probably in the next, I think in the next month for sure. Bids will be open probably mid to late March for that, and construction will commence shortly thereafter. Savannah Green, we've engaged a consultant to perform a pavement rehabilitation study to look at the alleys and Smith Road throughout Savannah Green. We've got a lot of failing pavement through there, and we want to look at some alternatives for reconstruction or possibly rehabilitating some of that, just so that it's a little bit more functional for the long-term use. Savannah Green was kind of an experimental development, not experimental, but it was a new style of development in the early 2000s that the city pursued. And there's some challenges with the alleyways there. They were constructed per our roadway standards, but I think just the general use of those alleys has made it hard for that pavement to really hold up its life. Windsor resurfacing from Race to the West Boundary. We have preliminary design drawings that we've reviewed and sent comments back to a consultant on, and I think the anticipation would be that will be out to bid. The design will be complete by the end of the fiscal year, potentially out to bid before the end of the fiscal year, and construction will likely commence in the fall. Philo Colorado Anderson is a similar time frame. It's probably lagging a little bit behind. This may be a fall bid with construction spanning fall and then next spring as well. And then the Carl Sanitary Sewer was a project. We've got a sanitary sewer that runs below Carl Hospital that we're working on. We're meeting with a consultant this month to talk about creating a scope for performing a feasibility study initially to see what our alternatives are to potentially divert flow and get out of potential liability headache between us and Carl both. And we've been engaged with Carl on this already, and we'll continue to do so as we get a study started on that, and UCSD potentially, depending on the need for a lift station. And then the last one is the Washington Street Bridge reconstruction project. This came up. This was not part of our original plan CIP, but based on the bridge inspection that was completed in FY21 and a follow-up visit by IDOT, this structure has received a 12-ton load rating, which restricts MTD buses from traversing over this bridge, which they've been deferring their routes since we found out about this, and they're very interested in how fastly we can get this repaired, resolved. This bridge was actually looked at for replacement in the early 2000s by the city engineering staff. At the time, the driving force was some drainage concerns, which potentially have since been resolved. But what we've done is the initial phase, we've got a contract with a consultant to do a hydraulic analysis to verify if we still have drainage concerns in addition to the structural integrity concerns we have. The hydraulic analysis could potentially reduce the scope of the project if some of the drainage concerns from the early 2000s have been resolved. And that is it. Like I said, I hope this will be more interactive in the future and we can walk through this a little bit more interactively on a map. But for now, that's what we got. And I would entertain any questions, concerns, and I'm happy to provide additional information for anybody that wants it.
We'll go into council questions in a minute, but I just wanted to add, it's important for everyone to understand the intentionality behind this, what we're seeing here tonight, especially when it comes to the facilities projects and the equal projects. The planning for and the underlying studies and assessments that now support these facility projects started 4 to 5 years ago. So when we did the overall facility study and programming needs assessment in the city, when we did the citywide pavement assessment, the stormwater master planning update, all of those laid the groundwork for the facilities that we're seeing today. So the fire station replacement, the city building renovations, the ADA upgrades, and then the financial planning that has gone into practice over the past 4 years allowed us to give the extra $2 million to the equity and quality of life infrastructure projects in the neighborhoods. So all of this, what you're seeing, much of what you're seeing on this list here in terms of our facilities projects had their beginning 4 and 5 years ago. And that's what it takes to bring projects of this scope and scale to fruition in a city. And I don't think unless you've been involved in the planning or seeing what goes on behind the scenes, people sometimes don't realize how much time it takes. Things don't just pop out of the ground when it comes to projects like this. So I truly appreciate the work and planning and effort that staff and our consultants have put into this, because it's really gotten us to a really good place right now. So any questions for Tim? I can't see everybody's hands. Mary Alice and then Grace.
I don't actually have any questions. I just wanted to thank Tim and all the other people who've been working on these projects for this update. I don't recall, maybe it has happened, but I don't recall ever getting an update on all of the different projects that we've had in the past. So it's greatly appreciated.
Welcome.
Grace.
Thanks. Yeah, also want to say thank you for the presentation and the organized update all together here. And I was wondering about the Carl Sanitary Sewer. If I imagine that is there not any cost sharing on that? Is that kind of the city infrastructure? And you mentioned avoiding possible liability issues. Is that kind of like figuring out where that line of responsibility is? Or wondering if you could explain a little more about the responsibility and the cost associated with that.
Sure. As of now, everything is anticipated to be city-borne cost. The current setup is that we have sanitary sewer that runs below Carl. Typically for like private sewers and things of that nature, building sewers within their own confines are just private sewers and they're just serving themselves. But in this instance, we actually have other public wastewater flow that's traversing through this same line. So thus making it more of a public asset. We've talked with Carl. They have some setup in their basement that we're looking to learn how to function, but I think it's essentially set up that allows them a certain amount of wastewater detention at their own facility, provided we had an issue within our public sewer so that they could continue to operate in emergency conditions without sewer service. I think the long-term goal here would be trying to create a more clear delineation between the city and Carl at the end of the day. And some of this is going to have to look back on some of the history of this setup and what's going on here, and kind of looking at more of a long-term I think from Carl's standpoint as well as ours, there's a benefit to creating this delineation and trying to resolve any potential issues before there are potential issues. I don't know if there's going to be a cost share from them at all at this point. I wouldn't necessarily foresee it right now, but I do think there's a shared benefit here. So that will be something we'll engage with them on as we get a little bit more information figured out. My intent is to kind of get the feasibility study done to see what are the exact constraints and conditions we're dealing with, what are our feasible alternatives, and depending on what comes out of that, probably discuss those alternatives with both Carl and potentially UCSD as well if they need to be a player in this.
Thank you.
Yeah.
Yeah, I also wanted to just say thank you for, I know you were talking about wanting to make it more interactive, but I thought this was really clear and really helpful to kind of see where things are. And the CIP, there's so much in it, and just to see all of the work and all the progress that's happened is really impressive. And I really appreciate the update. So thank you.
You're welcome. Thank you.
Any other questions? Okay, you were so thorough. There are no questions.
All right. Well, I appreciate everybody's time, and certainly feel free to reach out if something piques your interest later on. I think one more nugget I meant to add in here is this consists of about 35 of our projects in the FY22. And of these 35 projects, this is about $14 million worth of money that we're appropriating in all of this, just to kind of give it some scale for everybody. I appreciate everybody's time. Reach out to me if you need something.
Thank you, Tim.
Thank you.
Okay, we'll move on to council input and communications. If any council members want to make comments, you'll have up to 3 minutes.
Yeah, I thought I would mention this one more time because I've received a number of communications from residents about concern about Urbana and regulation of beekeeping because of what the county was considering, which I understand the county has now eliminated. I just want to make it clear to the citizens of Urbana, there was never anything on this council's agenda for changing the way beekeeping is currently handled in the city of Urbana. That was completely based on the county trying to change their zoning and the possibility that the city would weigh in on the change of the county zoning because it's within 1.5 miles of the city limits. So we've never thought about that. We have no intent, as far as I know, to think about that. So beekeepers in Urbana do not need to worry about that at this point. Thanks.
Chris.
Thank you. In September of 2020, the city of Urbana recognized its own priorities to increase minority participation in city procurement, hiring, and contracting, and to work with the Human Relations Commission to develop a system to incentivize and advocate for equity and increased minority employment rates by unanimously passing an intergovernmental agreement with Champaign that would allow Urbana to access the Champaign Diversity Advancement Programs database in order to increase contracting with businesses owned by women, racial and ethnic minorities, and other economically disadvantaged businesses. So what is the status on the city's bid documents reflecting our hiring goals, our procurement policies, and a business registry published on the city's website? In addition, hopefully we can find a way to fund a compliance officer to help us maintain minority-owned and women-owned business participation. As we recover economically from the pandemic and as we battle gun violence and crime, equal opportunity for employment is going to be critical. The city of Urbana can do its part to set the example and lead the way to a better local economy. Thanks for letting me speak.
Thank you. Any other comments? Chandra?
I just wanted to point out to my fellow council members that Carol Mitten sent an email earlier today with the final draft of our scope of work for a community safety review. I just wanted to make sure you put your eyes on it so that we can move that along as quickly as possible. Thank you.
Jaya?
Just to piggyback off of that, I wanted to thank Carol and the city staff who worked on that document. Very pleased with what I've seen of it so far, and know that that's been something that many of us have been pushing for since this term started. So just really appreciate the staff's efforts on that.
Any other comments by council members? Okay, we'll move on to reports of the standing committee. And I understand, I just needed a parliamentary opinion on this. If a council member wants to remove an item from the consent agenda, do they need a motion and a second, or can that request just be made and it be pulled off?
I think that that request can just be made since they've already discussed this stuff in the beginning, and she can pull it out for further discussion.
Okay, well, I'll call on then Councilmember Jaya Colasetti, who chaired the Committee of the Whole.
Sure. On behalf of the Committee of the Whole, we've got, I think, 16 items on our consent agenda, but it sounds like we are pulling one item out. Grace, what item did you want to pull out?
Yeah, I was hoping we could pull out item A to the regular agenda because I plan to abstain from that, so I could still vote on the other ones.
Okay. So we're pulling out resolution number 2022-02-018R, which is the resolution accepting a grant from the Champaign County Environmental Stewards. Okay.
All right, so starting with that item, on behalf of the Committee of the Whole, I'd like to recommend resolution number 2022-02-018R, resolution accepting a grant from the Champaign County Environmental Stewards for approval on behalf of the City Committee of the Whole.
Is there a second?
I'll second.
Moved by Jaya, seconded by Chandra. Will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Colasetti,
Yes.
Ms. Bishop,
Yes.
Ms. Wilkin,
Abstain.
Mr. Quisenberry.
Yes.
That motion passes. And since we're actually put that on the regular agenda, let's just go to the other regular agenda item, which is ordinance number 2022-01-007. And then we'll go back to the consent agenda with your permission.
Right. On behalf of the Committee of the Whole, I recommend ordinance number 2022-01-007, an ordinance amending ordinance number 2018-12-082, Urbana City Code, Chapter 2, Administration, Article 4, Boards and Commissions, Division for Arts and Cultural Commissions and Arts and Culture Program, adding a new youth member to the Arts and Culture Commission for approval.
Is there a second?
I'll second.
Moved by Jaya, seconded by Mary Alice. Will the clerk please call the roll?
Ms. Wu.
I think Chandra had a question.
Oh, okay.
Chandra? You're muted, Chandra.
This was one that Rachel was amending a bit. Was settled?
Yes.
She sent a follow-up email confirming.
Okay. And just making sure that it was correct in the title now.
That's correct.
Okay, thanks.
Will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Colacetti,
Yes.
Ms. Bishop,
Yes.
Ms. Wilkin,
Yes.
Mr. Quisenberry.
Yes.
That motion passes.
All right, I have a procedural question. Do I need to read all of the items that are in the consent agenda or just? All right, here we go. All right, on behalf of
Take a deep breath.
of the whole, I recommend the following items on the consent agenda for approval. Resolution number 2022-02-004R, a resolution approving and authorizing the execution of a Urbana Home Consortium subrecipient agreement, Courage Connection TBRA. Resolution number 2022-02-005R, a resolution approving and authorizing the execution of an Urbana Home Consortium subrecipient agreement, Champaign County Regional Planning Commission, TBRA. Resolution number 2022-02-006R, a resolution approving and authorizing the execution of an Urbana Home Consortium Community Housing Development Organization agreement, Habitat for Humanity, Chodo Developer PY 2021. Resolution number 2022-02-007R, a resolution approving and authorizing the execution of an Urbana Home Consortium Community Housing Development Organization agreement, Habitat for Humanity, Chodo Operating PY 2021. Resolution number 2022-02-008R, a resolution approving and authorizing the execution of an Urbana Home Consortium Community Housing Development Organization agreement, Habitat for Humanity, Chodo Certification PY 2021. Resolution number 2022-02-0009R, a resolution approving amendment number 1 to a City of Urbana Community Housing Development Organization Program Agreement, Habitat for Humanity, Champaign County, Inc. Resolution number 2022-02-010R, a resolution approving and authorizing the execution of subrecipient agreement, Youth Services Agreement, Urbana Neighborhood Connections Community Studies Center. Resolution number 2022-02-011R, a resolution approving and authorizing the execution of a subrecipient agreement, Youth Services Agreement, Urbana Neighborhood Connections, Urbana Youth Development Program. Resolution number 2022-02-012R, a resolution approving and authorizing the execution of a subrecipient agreement, Youth Services Agreement, Steam Genius DBA Hip Hop Express. Resolution number 2022-02-013R, a resolution approving and authorizing the execution of a subrecipient agreement, Youth Services Agreement, HV Neighborhood Transformations Teen Summit Program. Resolution number 2022-02-014R, a resolution approving and authorizing the execution of a subrecipient agreement, Youth Services Agreement, Don Moyer's Boys and Girls Clubs, Transportation for Youth, for Urbana Youth. Resolution number 2022-02-015R, a resolution approving and authorizing the execution of subrecipient agreement, Youth Services Agreement, Don Moyer Boys and Girls Club CU Together Support Program. Resolution number 2022-02-016R, resolution approving and authorizing the execution of a subrecipient agreement, Youth Services Agreement, Champaign County Regional Planning Commission Youth Assessment Center. Resolution number 2022-02-017R, a resolution approving and authorizing the execution of a subrecipient agreement, Youth Services Agreement, the Well Experience Family Care Program. Ordinance number 2022-02-08, an ordinance amending Urbana City Code, Chapter 3, Section 343, increasing number of Class P liquor license for Philo South Mart Inc., DBA BP Gas Station, 1821 South Philo Road, Urbana, Illinois. And that's all of that. For approval.
I'll
Could we
second.
have a second? That's a much easier job. So moved by Jaya, seconded by Chandra. Will the clerk please call the roll?
Okay. Ms. Wu,
Yes.
Mr. Evans,
Yes.
Mr. Quisenberry,
Yes.
Ms. Bishop,
Yes.
Ms. Wilkin,
Yes.
Ms. Colacetti.
Yes.
That motion passes. Thank you. We'll now move on to reports of special committees. I don't believe there are any. Reports of officers. No, okay. Then we'll move on to new business. We have a couple of appointments tonight. The first is to renew the appointment of our interim director of community development services effective February 28th, 2022 through February 13th, 2024, or until filled, whichever is sooner. And we fully expect it to be much, much sooner than that, that particular date. But this is for Sheila Dodd. She currently serves as the interim director of community development services, and she's also the grant manager for the city of Urbana and provides staff support as part of that job to the Community Development Commission, and the bio was attached in the packet. We wanted to let you know that the request for proposals for a search firm to conduct the search for both the Community Development Services Director and the Police Chief proposals are due February 25th. We will pick a firm to do that and then get those searches underway. So again, we expect that this Community Development Services position will be filled as soon as we possibly can, but we wanted to just give time for Sheila to do her job. So I'd entertain a motion for approval. Mary
I
Alice?
would be pleased to approve interim director for community development services for the term ending February 13, 2024, or until filled whenever sooner for Sheila Dodd.
Is there a second?
I'll second.
Is that James? Okay. Any discussion? Will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Quisenberry,
Yes.
Ms. Wilkin,
Yes.
Ms. Colacetti,
Yes.
Ms. Bishop,
Yes.
Mr. Evans.
Yes.
That motion passes. Congratulations, Sheila. The second appointment is for the Housing Authority of Champaign County Board of Commissioners. Just for background information, this is one of a couple of boards that is an external board that the city of Urbana makes appointments to. So the RPC is another board, for example. So the Champaign County Housing Authority Board has 7 members. City of Champaign, City of Urbana, both make appointments. Then there's also one appointment from Champaign County and an appointment from the Resident Advisory Board. So we have one vacancy on the Housing Authority Board that will fill the unfinished term of Danielle Chenoweth. And this would be through January 31st, 2023. So I'm recommending for your approval Todd Salen, who's a 35-year resident of Champaign County. He works as a real estate managing broker for commercial and residential real estate. He works in both cities. He teaches both pre-licensed real estate at Parkland College and continuing education through the Champaign County Association of Realtors. He included a statement on his application that I wanted to read into the record. It's quote, "I'm consistently mystified how a community as wonderful as CU can have such poverty and homelessness, in particular the struggles many families have in finding a permanent residence. As a realtor, I take great pride in helping families find solutions for their obstacles and then helping them find their first home. There's nothing more rewarding than helping others take their first step." Champaign County is certainly not alone in needing to find solutions for homelessness, but certainly we have the willpower, the funding, and the wherewithal to find solutions to these challenges. I often mention the 300 Unit 4 students, the 500 UIUC students, 500 plus local families without addresses. We must find better solutions, and this board is a critical means to the end. Mr. Salen's community board service currently includes a role as executive secretary of the Rotary Club of Champaign, and he serves as a trustee at Faith United Methodist Church. Prior service included on the board of directors for Habitat for Humanity of Champaign County, volunteer work with the Daily Bread Soup Kitchen, the Salvation Army, and Empty Tomb. And I believe his experience, his professional experience as a realtor, and his personal contributions and service to the community give him the background and experience that will make him a very productive member of the Housing Authority Board. And again, this is to fill out basically the 1 year left in the current seat. When I was in a conversation with the director of the Housing Authority, one of the, I asked them what kinds of help she needed on the board, and she mentioned specifically people with backgrounds in real estate and the legal profession. So I think this meets the needs of the board. So I would entertain a motion. Jaya.
Can I just ask a clarification quickly? You mentioned a year and mentioned 2023, but on the agenda it says term end June 30th, 2025.
Yes, thank you. We need to change that to June 30th or January 31st, 2023. Thank you. Forgot to mention that. Kind of been a, came into office and there were no records. So anyway, thank you. So yes, it would be for the term ending January 31st, 2023. Is there a motion?
Yeah, I would move, oh, go ahead, Chandra. I would move approval of Todd Salen to fulfill the unfinished term that will, for the Housing Authority, Champaign County, that will run through January 31st, 2023.
Is there a second?
I'll second.
Okay. Any discussion? Okay. Will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Colacetti,
Yes.
Ms. Bishop,
Yes.
Ms. Wilkin,
Yes.
Mr. Quisenberry.
Yes.
Okay, that motion passes. Okay, we'll move on to the final item, which is discussion, and that is related to the goal setting session, final council goal setting session, which is scheduled for February 22nd, 2022. And Carol, did you want to introduce this?
Yes, please. So I just want to be sure that we are all on the same page about what your expectations are about how we will spend that evening. My understanding is A, that it will be the final session. B, I was under the impression, I could be wrong, but we just want to be sure that we are facilitating in accordance with your desires, that the topic would be the strategic area number 1, which is the public safety area, as opposed to revisiting all of the all 4. And then I wanted to also ask you a couple of other things that maybe you could give some guidance on. Let me just share my screen real quick to show the spreadsheet, just in case you all don't have it at your fingertips. So this is strategic area number 1, the public safety and well-being, and we basically have 2 strategies within that area. One is more on the short-term side, to pursue methods to mitigate community violence. And there's 2 basic buckets there. One is there's 2, A and B are both about addressing root causes of violence. One is through community organizations and the other is internal, but they're both around root causes of violence. And then there's the C there is to identify and fund options and enhance the current police investigative and operational capacity to address community violence and solve serious crimes. So they're sort of like solve crimes and prevent crimes. Those are the short-term things. And then the second one is to enhance and expand public safety resources. And that's largely focused on the community safety review and the outcomes of it. And that's more of a longer term proposition. So I'm wanting some guidance from you, and we won't have Kevin James with us that night, but Will Kolchowski and I will do our best to help guide the conversation. But we want to know, are you interested in more detail on these areas, these action steps that you are already identified? Are you interested in developing more, given that these are already quite meaty? And then my final question, just before I'm just kind of trying to get it all out there for your reaction, to the extent that ARPA funds have been identified as the resources for the 2 action steps that involve root causes. How do you see those? How do you see that conversation, whatever we might talk about on the 22nd, as it relates to those areas, dovetailing with the ARPA public engagement feedback, and then those discussions? So just trying to sort out what your expectations are about that evening so we could help facilitate the conversation so you get the outcomes you're looking for.
Yeah.
I'm going to see how much of that I can remember. And I will say, unfortunately, I'm going to have to be late for that meeting because I have a conflict. So if I'm remembering correctly from previous conversations, we went in reverse order. So we ended up with very little time for priority area number 1. And I think kind of partially out of that haste, there were other areas that were initially part of that some folks wanted to go back to and make sure that we were considering the whole totality of, did it make sense to narrow it down to this degree? Because like you said, that's meaty just with those few items. But I think that anything that's done in haste, there's always that chance for missing something. So I think that's one piece. That's my understanding. And I think that makes sense, right? To be intentional, especially about such an important area. I think the other piece that we talked about a little bit was as we were going through each section, there were times where we said, well, yeah, all of those are important, but we don't know if we can really do all of those in this time frame, but we're going to come back after we've looked at them all. And having run out of time for one of the priority areas, there really wasn't that opportunity for reflection, right? To say, okay, we've identified these different areas. Now, with all of this, do we think it's realistic to do all of these things in 3 years? So I think for me, at least, I think there are both of those pieces of needing to make sure we're clear on priority area number 1, but then also reflect on that overall conversation once that has happened, to think about what is feasible in this time frame. And then in terms of ARPA, I think that that's a great question, right? Of like, some of this is about that kind of intentional gathering feedback and those aspects. But I think we're also seeing with things like this, these are urgent, right? And so this might require us being creative if we have this great partnership with RPC, but there might be a need to utilize some of that funding that we already have to address some more urgent problems. So I think those are my quick responses to your very good questions.
Okay, thank you.
Yeah, thank you, Jaya, for bringing back that kind of step back and holistic view of what we've put here, and prioritization and feasibility is part of that. And one of the dimensions I think we said we would utilize in that is timing and resources, looking at what we ended up with, and that some of these, we may believe these are all important, but we may be able to make some commentary about staging, and particularly where they seem to be bunched up on a particular resource And so they can't possibly go forward at the same time, right? How do we fit those dimensions into the picture from a council perspective, which is admittedly a little bit removed and at 30,000 feet compared to what the staff might actually have to do to time things or prioritize them or put them in a work plan.
Grace.
Thank you. I want to say also, Carol, that I really appreciate having this conversation to kind of get on the same page, like you said, about the kind of expected outcome of it. I think that's really great. And I appreciate having this preliminary conversation going into that one. So thank you for that. I think I've been pretty vocal sending out some emails and things on my thoughts, but I'll reiterate that I do think it's important to touch base with the commissions. I talked to the one that I was on, and they actually had a lot of thoughts that they'd like to have as input on this. I know this is council and mayor, but I think it's great to include them whenever possible. So like their input on it, if possible, and then also how we could partner with utilizing the commissions in some of these goals. I think it makes sense to definitely finish the public safety one. I agree that there are some meaty ones, but also, like Jaya said, we cut down quite a bit. This is the smallest number of strategies and number of items out of any of them. So I don't feel like we left it really finalized. So I would like to focus on finalizing that first priority. And then I also agree that I think it is good to take a step back, and we didn't have the chance to review everything in totality and say, is this really the priority? Do we have the resources? And then I think the timeline is really important. I don't feel very comfortable that we're setting ourselves up to success when we don't have kind of set target timelines and when we plan to start working on things and when we plan to complete them. I understand that there's, needs to be room for flexibility. But I just don't see us setting ourselves up for success if it's like these things will take 12 months starting whenever we start them, which we're not willing to even speculate a commitment to when we would try and start these things. I think it would be really helpful to lay it out in a timeline on when we expect to start and complete things. And then I think that would also be a helpful exercise when we're looking at priority and timing. Like, for example, a lot of them falling on executive branch or community development. And are they okay with that? What does the staffing end say about the timing and the priorities and the resources available? So I think that's most of my thoughts for now. And again, I appreciate having this conversation to get on the same page for the next one.
So can I just get a general agreement that we may spend a little bit of time talking about overall execution and what that might look like, or check-ins or whatever, but the bulk of our time on the 22nd will be spent on strategic area number 1. Is that everybody's expectation? Because we'd like to we have invited, pending this discussion, more folks from the police department, so that depending on how we decide to have the conversation, even though we'll all be talking about the same thing, it's hard to talk as an overall group. And if we're using tables, then everybody would have have someone with expertise from the police department, so that they're there to kind of participate and bounce ideas off of. Because I think that the folks who had this as their small group found that to be useful. So we're trying to get additional people there. So I'll give it back to you to call on folks, Diane.
Okay, Chandra?
So I noticed that the action steps in this strategic area number 1 are very broad, whereas the other action steps are more, focused and narrowed. So for instance, funding community organizations, which ones, what does that mean? I think if we made it more specific, it would be easier to complete, as Grace said about the timeline. So I think going back to really iron out what community programs and what root causes are we trying to address. And I also think that making sure that the community engagement coordinator is present at the meeting if possible as well, because a lot of the outreach and the community organizations he has a lot of knowledge around. So I definitely want to have him in the room. I understand in inviting a few of the police staff, but I also think that a lot of, say for example, strategy one is a lot of like community engagement type of stuff. And so I'm not sure if they'll be the ones executing the community engagement portion, but just keeping in mind that the outreach and the community engagement, who will be actually performing that and making sure they're in the room too.
Thank you. Yeah, that's good. What I was thinking particularly, because we've had some internal discussions, is about sort of expanding so that everyone has a common understanding of what is the breadth of the root causes of violence, because it's not, that's quite, that in itself is quite broad. So we can do some prep work to break that down so that everybody has a common understanding coming in the door about what that really means.
And
But
just
we'll try to get Lamont there also. Good suggestion.
And just to dovetail and remind the public that in the previous discussion with RPC, the council identified 5 major priority areas to consider ARPA funding on, and those all intersect right here with root causes of violence. So you'll be talking about housing, economic development, job opportunities, there's infrastructure, and there's safety and well-being. So it'll intersect. Mary Alice.
So I apologize for not being able to be at the last goal setting session. One of the things that struck me on the strategic area number 1, as several people have mentioned, is just kind of how light the number of action items are, but yet each one is very, very broad. The second thing that I've been thinking about is really focusing some of it on well-being. Right now, a lot of it's based on public safety. And I know that community organizations, and maybe it just requires some tweaking of some of the language, but I do want to look at it with the lens of well-being as well, not just public safety. And I guess my third thing that I would say, and maybe this is more to Grace, which is talking about timelines and everything. I think that there is a lot of unknowns right now, and I'd rather see timelines on the initial stages and then set up timelines for things that come after that. So for example, having completing a public safety review will inform different items. And we don't know how long those different items will take after we come to that conclusion. So I'd rather, if we're going to sit and talk about timelines, I'd rather talk about like the order of operations, what needs to come first, and that first item be that timeline. And then we can figure out the timelines after we complete those.
Okay, James.
Yeah, I do want to point out that we didn't remove anything from the strategic area number 1 or take it off the table. They were actually broader and had more things in them for the last round, and some of those things got shifted to be aligned with some of the other areas. There were things under the public safety and well-being that lined up with housing or lined up with infrastructure that got moved out. But I just didn't want anyone to get the impression who's watching this that we had things in public safety and well-being that we took off the table. They just got aligned with other areas. And in fact, it had, I think, the more items as we went in the last round of working through where things fit.
Okay, Jaya.
So I wanted to come back to Grace's point about the timeline. So initially, you know, the duration column did have time frame, I think was what Kevin had on there. And I think that was intentional. I would agree with Grace that it provides some level of accountability, even if it's saying, you know what, we're still in this pandemic, we're behind schedule, we're not able to do it. I mean, I think about the presentation we got tonight about the CIP, right? Having that frank, open conversation of, yep, we're on track for these, we're doing okay, or no, we're really not, right? It provides that level of accountability that if you're just like, yeah, well, we're going to start it and then we'll see. It's not to say that those timelines can't be changed, but I think for this to have teeth, for it to have kind of that impetus to get things done. And I would argue that that's what Kevin said too. If the reason you put those timeframes on there is so that you have those touch points, you have those opportunities to look back and say, did we accomplish what we said we would do? And that's why you make them actionable. So I would agree there's more fine tuning to do here to make some of these action steps more actionable. But I would argue that it is actually valuable and important to have specific timeframes, not just a sense for how long those programs would take or those pieces would take.
So if we can talk about this more on the 22nd, and we'll have different staff people there who may be able to offer commentary too. But I don't want people to lose track of the fact that the reason we prioritize the items, and then we did, I actually am the one who changed this. Sometimes it says duration, and then there was one group that actually put dates on things like ongoing or each September that says time frame, and then under infrastructure they put actual dates, and so those say time frame. And the issue was I'm going to stop sharing because I just made everything go away. The things we prioritize them because we want staff to focus on the first priority first, and the other things won't necessarily be done simultaneously. They'll be done in sequence. Doesn't necessarily mean they won't start an item until the first one's done, but we wanted to communicate clear priorities. So then if you start having things cascade that have 12-month durations, then it looks like you wouldn't, if you actually put dates to that, then it looks like you're not actually starting it until the first one's done. And so it's a little hard to manage that way. So what I'd like to do is have some of the people that would be managing these things give you some feedback about how they would like to be held accountable for implementing these things. Because I would like to give a general. And remember, we're sitting at tables kind of spitballing the timeframes. It wasn't, it wasn't real scientific, and it wasn't with a lot of consultation. But I'd like to let the people involved sort of offer some ideas about how they would like to manage this, if that's acceptable.
Yeah, ultimately, the staff is going to have to operationalize this. So council is being asked to set the goals, strategies, and action steps, and then we'll have to have staff operationalize it. Grace.
Sorry, lost my mute button. Thank you. I agree with having input from the staff and the people who are going to execute these things for the timeline. I think that is definitely important. I think that, as I said, it's useful to have that timeline for accountability and just checking in on progress, because it also seems like there's no real way for the council or public to really check in and ask for an update if it's something that's just like, it'll take 12 months whenever we start, instead of like, now we know we have to do this piece first, so we're not starting that until 6 months from now or whenever it is. I think that would be a really helpful planning tool. In the infrastructure group that I was in, we did set deadlines, and I think that also in exploring and looking at things, like, can I share real quick? Is that okay? I did it. Okay. In something like this, we realized that we had set a lot of our completion things we just said like, okay, the end of 2022 sounds nice. So we set a lot of things for December. And I think when you can visually lay it out a little more, then we can look at it and realize like, oh, is that really the best thing? We set it because it sounded like a nice end of the year kind of goal, but is that actually the best thing to be working on? And if not, then let's reevaluate that. And I think it's kind of important to plan that ahead of time. And I think that as far as the prioritization, I think it does make sense. And I think we could also start on some earlier, like in our last one for infrastructure. I had C, this is just a hypothetical draft, but I had C starting earlier than the others, even though it's a lower priority. But I think that in this case, it does make sense because this is one that I've been kind of involved in with Scott Test. Like we have a UI/UC class helping in some of the research already because this is when their semester's starting. And I think it is important to have the input from the people who are actually going to be working on it. And I think the prioritization makes sense. And I think that it might not necessarily fall in a linear order. Like you said, there might be some things starting, taking longer. And I think it would be really helpful to have more specifics laid out.
Well, actually, you point out a very good example, the infrastructure group, which I sat in on as well. We also had the director of public works and the deputy director for operations. So the two staff members who knew exactly what their situation was and had a very good idea of when this stuff could be done were actually helping set these timelines, which is what we mean by operationalizing it. We need the people who are going to do this work to be the ones who can help set some of these this timeline. So I think that it can be done. We'll set the touch points, we'll get it done, but the infrastructure had more specific dates because the very people who were going to do it were sitting in that group. So that's an example of how we need to involve the staff in establishing these and setting up the touch points and the updates. Jaya.
So I think what I'm hearing, and I think all of us agree, right? We're not just gonna be like, staff, go do the things and when we say you should, because we don't have that context. But it sounds like for this meeting, having an understanding of, setting those priorities like we've talked about, and then maybe just making that plan for operationalizing it, right? So like maybe that's the piece that council can kind of put their teeth into, because if we're saying, these are our priorities, I think that saying we need to be held accountable to the priorities we're setting is an important piece of it too. So finding that balance of, yes, of course, staff are the ones who are actually going to be implementing these pieces, and they need to be involved in that process of determining what's a reasonable timeline. So I think there's kind of compromise there, right? Of like recognizing that a conversation about what operationalization should look like could be part of what happens in next week's meeting, but also recognizing that some of those specific targets might need to be determined once there's more opportunities for involvement with staff. But at least I will say for myself, I would still like to see specific dates whenever it is possible.
Sure. Yeah. I mean, the top priority for the 22nd is to identify and finalize the goals and flesh out any action steps that you think need to be there. And then we can also talk about what kind of reporting and accountability that needs to be there. This is, and again, when we started these goals, it was for 1 to 2 years. So that's also what we need to keep in mind. Can this is this realistic for 1 to 2 years? Given everything else, this isn't the only thing we're doing. So is it realistic for the next 1 to 2 years? And then how are we going to get it done? Okay, I think we got.
I appreciate the conversation. Thank you.
Okay. And we'll be sending out more information about the meeting on the 22nd. Format will be very similar to the previous sessions. It will be in a different location, but all that'll be posted. Well, I guess that brings us to the end of our agenda. Happy Valentine's Day. You still have time to go buy some flowers if you need to. Otherwise, enjoy your evening. Thank you. Bye-bye. This meeting is adjourned.